Most of the patients who come to our clinic say they want to get implants. Patients who want to get implants must first provide us with all their information. We need to learn about the general health condition of our patients. If they are using standard medications, we need to know about their routine medications. Apart from that, we need to look at the patient's tomography to identify any personal conditions. In the tomography, note that we can only see the bone density, bone length, or general criteria. Can we remodel that bone? Can we mature that bone again and place an implant in the area? We can assess these. However, sometimes the bones are not good enough. Sometimes, when we use artificial bone graft material, we cannot achieve the desired quality and maturity. These are determined by the data that previous medical and scientific studies have provided us. Therefore, we need to determine in advance under what conditions implants can be placed in the patient's areas, and if implants cannot be placed, how many implants can be done. After determining these, we also need to decide what type of implant-supported prosthesis should be used in such cases, because just placing an implant is not enough. Ultimately, we want good function, good aesthetics, and good hygiene as the final outcome. If we cannot meet these conditions, there is no point in placing an implant. The importance of placing high-quality, safe implants at the correct points is very significant. At the same time, besides bone quality, the health of the gums is very important. Having good gum health, ensuring that the gum around the implant is tight, firm, and capable of maintaining good hygiene without allowing bacteria is one of the most crucial aspects. This issue is often overlooked in many places. Therefore, when it's said, there's bone here, let's place an implant, and then make a nice tooth on top of it, it gets done. But after 1 or 2 years, hygiene problems, odors, bleeding, and pain begin. Therefore, the patient is a whole. The patient's overall health, routine medications, bone structure, gum structure, and the patient's healing potential. All of these are things that need to be evaluated together. That's why when we are planning an implant for our patients, we want to learn and obtain all the data clearly. Later, with good planning and a good prosthetic structure, we send our patients off in a hygienic and well-functioning manner with a smile. All dental treatments are personalized special treatments for patients. As the sector standardizes, it is developing to increase the applicability of standard implants. No matter what, every person, every individual has a unique body and constitution. Here, when we make our implant selections, we choose based on the density of people's bone structure and their overall condition. In other words, we also make choices among the types of implants. Sometimes there are situations that require immediate loading or immediate aesthetic treatment. For such situations, aggressive implants are preferred. Sometimes, due to the scarcity or limitation of natural tissues, we use special short implants tailored for that. Sometimes, due to bone deficiency, bones from different regions are used and different models and derivatives of implants are chosen. No matter what is chosen, the type of prosthesis to be placed on top should be light, flexible, and protective of the implants. While we are making these videos, we will occasionally share implant cases and sometimes share how the prosthetic structures on top should be. You can follow us to get information about types of implants and the types of prostheses that need to be applied on them.